Good morning, I'm Susan Acott and I'm the Chief Executive at East Kent Hospitals, and this morning I am privileged to be at the Canterbury Cricket Club where we are doing a large amount of vaccination. So that's the noise that you can hear in the background, that we're actually in the vaccination centre. Now with me today are three colleagues who've been front and centre of the vaccination effort, and I'm just going to get them to introduce themselves. So Pauline, can I start with you?
Yes, hello, I'm Pauline Treadwell, I'm Head of Occupational Health.
Will?
I'm Will Wilson, I'm the Director of Pharmacy.
And I'm Robert Nelson, I'm the Deputy IT Director.
Fantastic. So I have to start with Will. So if we go back to the start of this vaccination programme, Vaccinating the World, we were one of the first hospitals to start the vaccination programme, and we had the vaccine that had to be deep frozen. So Will, that first morning when you were getting into the deep freezer, tell us all about that.
It was surreal in so many ways, in terms of we waited so long for this, and then it came at us so quickly, and I'm there with my PPE on, digging out the vaccine from embedded within sort of dry ice, hoping that I've got all the procedures right, filling out all the bits and bobs and thinking, this is the day that we start this. And all the work that had been going on behind the scenes to get us to a point where we were ready to go. It's a day I don't think I will ever forget.
Must have been I know I was very emotional about it when we started the vaccine. You feel that you're at the start of a global effort. It felt a huge privilege.
It did. And actually being part of, the wider team, working with Pauline, working with the IT team, in terms of getting us to a point where we were taking this vaccine to defrost it, to go to the clinic, that, we'd stood up at such short notice because of the timings. It was amazing.
And Pauline, so you had to go from a standing start, perhaps not quite knowing what you were dealing with.
Yes, and I think because we had to do a lot of learning in occupational health regarding the new vaccine and how to mix it and draw it up, which Will's team and the quality assurance team helped us with. And also my team was pivotal and in getting them trained in delivering it, because we're also passionate about our vaccination programs, that we wanted to deliver it as soon as possible to as many people as possible, and luckily we've been able to achieve that. But that first week was slightly daunting, but also a huge achievement actually for us as a team to be able to do what we've done.
It was a massive achievement, and I remember we worked late on a Friday night. I say we
did.
but we worked late on a Friday night to try to make sure there was no wastage. And I remember people, the staff who were arriving, just so grateful to be part of that. They were so grateful to get vaccinated and to be part of it right at the start. It was a very buoyant feeling.
It was, and there was lots of different specialities that were all come together, and more so now in here at Canterbury, where we've trained a lot of people to be vaccinators and to be prescribers. And like Will said, with the team effort with IT as well, to produce a programme that is national, and to be able to do that for everybody is fantastic achievement.
Yeah, and of course one of the big issues around this is to try to get people to book and to come and arrive and to go through a small start of doing hundreds a day to be able to do thousands a day. So Robert, so just in terms of your involvement of helping organise this into the kind of industrial process that it has become, tell us about your involvement.
Sure, so I was brought in about week two, towards the end of week 2, to stand up a facility at Canterbury. And we looked at the outpatients model, and it was working really well. It had been fine-tuned at William Harvey, but it wasn't going to deal with the numbers that we were hoping to put through here. So I looked at a sort of, it's not a mass vaccination centre, but a hospital hub type situation where we could bring through 600 people a day. And of course, I am an optimizer, I'm very comfortable in spreadsheets and things like this, so I designed a model in a spreadsheet. But of course that had to be turned into reality. So checking everything with Pauline and Will and others that were going to be here, making arrangements for the accommodation. But of course when it came to the day, whilst everything looked great in a spreadsheet, I was completely terrified that with real people this just might not work. I had lots of reminders from Pauline, great ambitions Robert, but just remember we've got people here. And actually on the day it was just a marvellous feeling for me. I was here, I was terrified, Anka, who I can see in the background, came up to me. She said, "I've been awake since 3 o'clock." And I was worried that she was worried. She said, I've been so excited about doing this, and it just made me feel so warm. I thought I'm really part of a huge team that are massively enthusiastic to be doing the right thing.
I did come the other week and I took a picture of your team, and they were all in different scrubs, which
Yes.
probably symbolised the fact that you brought these people together from all different specialties.
There is,
Tell us
yes.
about how how that process has happened, and effectively you've put a new team together here.
Well, there's lots of different people volunteered originally for Ashford, and then when it was developed for here, Elisa Still in the IT team was able to draw together some volunteers from different services as they've been stood down at the moment. And then it's getting them trained. So there's a lot of national e-learning that they've got to do. Everyone's done it, and they've all been enthusiastic about doing it and impressed at how much they've learnt. But yes, lots of different people from theatres and from outpatient staff. We've got the outpatient booking team helping us, and they've had to learn a lot of different new IT software systems as well. And we've also had the pharmacy team doing the training of everyone in how to mix and draw up as well. So yes, lots of different specialities, and we couldn't do it without them.
Will, just from your point of view, so we've had lots of volunteers and people who have come from different specialties to come and assist, but at the end of the day, the pharmacists, you can't volunteer to be a pharmacist all of a sudden, so your pharmacy team must have been quite spread out trying to add this to their responsibilities.
I think it's different aspects of pharmacy. So much of this is around distribution, and often we talk about pharmacy as we can do lots of really innovative things, but if you open the cupboard and the medicine isn't there, then it's all for naught. And so much of our focus has been ensuring that the vaccine is here, that we support the team in learning how to mix it, because that's really critical. We keep an eye on the quality, so my quality assurance team with all the procedures have been supporting that, and behind it all my distribution team, making sure that that vaccine is here when it's required, as it's required, and ensuring that we don't have more than we need, but we have enough to ensure that we continue to vaccinate the numbers that we can do. So it's been really inspirational in many ways just to see that part of the team that you don't often see and do such a wonderful job. You know, I'm eternally grateful for that.
I have to say, you're wearing your badge of recognition there, Pauline. I mean, I think at the end of the day, hopefully people will remember that they were part of something, global. This is the start of a global effort to try and defeat this dreadful disease. But at the same time, people have been really excited to be part of that, and they have appreciated learning new skills. So,
Totally, and I think it's been nice for other teams. Earlier we were talking to one of the theatre sisters that are here, and she was saying how it's nice to get out of theatre sometimes and actually to meet and do and retain some of her older nursing skills have come back to the fore, because she's used to dealing with the unconscious patient in theatre. So therefore to be able to have that engagement with people coming for their vaccinations, as well as that intermixing of different teams as well. And for us in occupational health, it's been lovely to be able to get out of our little silo to go out and work with others.
when I've done these podcasts, it's been great just to get people to say what are some of their sort of abiding memories of this which will stay with them. So Pauline, what is the kind of the one thing that will stay with you, or that you recall when you look back on your vaccination journey?
I think it's mainly been us coming together as a team in occupational health, because we're working in different sites and we don't see each other very often, as well as working with everybody else to be able to have that collective team effort for this programme.
Will, what about you?
For me, two things really. One, my aseptics team are here training, and to say it's so nice to see what we actually make being given to people, because making chemotherapy you never see what's then given. And the other thing was sitting with the consultant anaesthetists and the engineers, looking at the oxygen, and somebody saying you're going to need a bigger pipe, as we were starting to figure out the enormity of what was coming and how we were going to manage it, which we then did.
Yeah. Robert, what about you?
Well, for me, I'm relatively new to the NHS, and for me it was the way to see, I mean, the NHS is always rising to challenges, but this was a challenge, and to see the way that everybody comes together to rise to the challenge with such enthusiasm watching the members of staff waiting for their vaccinations and thinking, oh, it's freezing out there, but not one complaint from the queue, and then seeing them leaving and saying thank you with a big smile on their face, so relieved to have had the vaccine. So it's just the way the NHS meets challenges and just deals with them.
I must say, I think when I go back to that Friday evening when we were trying to get through the remainder of the vaccines, and we called people, we called for help, didn't we?
Yes.
And literally we had staff that came from every hospital, every trust.
Yeah.
We had people come from general practice
And
and
there was
Darrett Valley.
new and old vaccinators, wasn't there?
Yeah. So it's very interesting when you ask for help, you know,
Yes.
build it and they will come, and people came from all over the county to help in terms of that vaccination. It was a really amazing, and people were very, very pleased to be involved, and I think very proud to have been asked.
I
Great
think one of
memories.
the best achievements is that we were the first hospital hub in Kent, and I think that's a huge achievement, really, to be able to start that process.
Robert, you're very proud to be involved, aren't you?
Yes, I am. I mean, I'm an IT person from day job, so it was great for me to bring whatever skills I have to make this work, to allow us to stand up, to deliver high quantity of vaccines in a safe environment. And it's been fantastic for me to be involved in that. I love to be solving problems, I love to be optimising, but actually you rely on the staff and the skills and the expertise to deliver that, and to be part of that is a fantastic privilege for me.
Well, I have to say it is one impressive effort, and I'm really, really glad that you've all been part of it, because you've been amazing, and I think you've done an absolutely fantastic job, and it's just brilliant to see these people getting vaccinated today. So thank you very much for sharing that with me, and yeah, I'm looking forward to seeing how many people you've done today, but it looks like an amazing effort. Thank you.
Thank you.
Thank you.
Thank you.